Time for Connections. Today we will be speaking with Brian Fough, a national of Saint Kitts and Nevis. By profession, Brian is a senior system architect in healthcare and a software engineer with over 20 years of experience. And we have the pleasure of speaking with Brian all about his intriguing career. Welcome to GMSKN's Connections, Brian.
Good morning.
Good morning.
All right, so it's always a sheer joy for us to connect with people who have Kittitian and Division roots, as I was saying a little earlier. And so we want to know, in your career as a senior system architect, what exactly are your responsibilities? How can you shed light on what that is for our viewers?
Sure. So what a systems architect does in context of software is to basically, if you think of an architect, a traditional architect who designs how a building should be built, how things should work, how things should interconnect within itself and with the environment around it, it's very similar. So what I do is, as long as there's a problem to be solved with software, then I take a look at the environment, I take a look at what's needed, budget, things like that. And I basically define how that system should be built and maintained going forward.
But I know it's more extensive than that. But thank you for simplifying it for us.
So, Mr. Fough, was there anything in particular that motivated you towards healthcare information technology?
Yeah, well, you know, my mom's a nurse.
Okay.
And she's been a nurse for almost all of her life. And so I've been exposed to healthcare since I've known myself. Growing up, computers was an interest later on in life.
Okay.
So I did my undergrad degree in computer science and systems engineering at Howard University in Washington, D.C. And it's funny, you know, soon after graduation, I was working not in the healthcare space.
Okay.
I was doing more community-based, you know, connecting communities, things like that. And I got a call from another Howard alum who was putting together a system for the National Medical Association. And he was, you know, it was almost like a desperate call. He was behind schedule. He was almost at budget. And so I went to see what was going on there. And he started to explain what we'll be doing, how the system will be used. And so, long story short, we did the project. It was very successful. But then getting a sense of how software could be used really to help people's day-to-day lives in healthcare, that was like eye-opening for me. Mm-hmm. Like I said, I've been around healthcare before, but it's been very hands-on, very offline. But now the switch to software was intriguing, and I just kept doing it.
All right, so if you could paint a picture for us, without, of course, divulging too much information that would perhaps implicate your previous work, what can you tell us about what you've learned about the impact that software has on healthcare? What was the most intriguing part of it for you?
So we that's a very good question. So in day-to-day, we sort of take a lot of things for granted. So at the time I worked in Washington, D.C. It's a very vibrant city, lots of cultures, because, you know, we have the World Bank here, we have IMF, we have all these multinationals, then you have all these different universities and schools. So it's a massive melting pot in a very small area. And so you go about your day-to-day life, and you take it for granted that everyone is not as vibrant, moving around, able to get what they need done, even in a very developed place like this. And so when you get exposed to folks who have a lot of fears, anxiety, other things like that, or they have real physical impediments that, just like the psychological impediments, sort of limit them from going out, from living life. One of the things I see very clearly is that one condition often leads to another, right? So diabetes, I work a lot with the diabetes treatment center at the hospital at Howard. And, you never just have diabetes. There's hypertension that goes along with that. There's weight, there's like weight problems. So if you could begin to put some of these people at ease, if you could begin to give them a little bit of confidence that they could stay in a very familiar place at their home, at a family member's home, and still be able to connect to healthcare providers and get the care they need. It's very impactful that way when you see the transformation.
Oh, well, thank you for sharing that.
Yes, indeed. So what has been your most favorite project thus far, Mr. Fough?
I have a lot of favorite projects. I've been lucky in that there's, I've worked on many projects that I happen to like.
Okay.
If we take, for example, the Diabetes Treatment Center. So diabetes is what they call a chronic disease. So this is something that you live with for several years. And so in coping with the disease and treating the disease and getting over the disease, it's daily. It's like a daily thing. Now, can you go to the hospital daily? Maybe, but it's a pain. They'll probably turn your back after a while. So you need to provide these services at home. And so the solution that we have is a combination of a website, a portal, and a mobile app, and along with medical devices. So I'm sure that everyone has gone to the doctor. You get the blood pressure cuff, they put it on your arm, they pump it up. You take your blood pressure. We have that in the homes of the patients. We have weight scales in the homes of the patients. We have glucometers where you prick your finger, it takes the blood glucose reading from the blood sample. These are in the homes. And so, but they're digitally connected. So they're wireless, they're Bluetooth. So you could picture a given morning, you step on the weight scale. Before you have a meal, you check your blood sugar. Somewhere along the day, you check your blood pressure. These readings get sent to our system via the app. There's a connected mobile app, and then they show up on the doctor's screen. And so our center cares for 900 plus patients. So every morning there's like a feed of tons of data points from different patients, and the physician or the nurse who's monitoring that could see how Mr. Joe is doing, how so-and-so is doing, and should there be any anomalies, like a spike in one of the readings, then they could quickly take action. So they could, first they'll measure if it's serious, on a 911 level where you have to call the ambulance, or if they need to intervene. And if they do need to intervene, they could spark up like a video call, like a Skype or Zoom, and speak to that patient and see what's going on. And then they could also do medication refills if they need to, or start some sort of treatment or extend the treatment. So that's like the whole system. There's devices, there's your laptop, there's a mobile app, and right at the comfort of your home, you could get all these medical services.
So Brian, with having over 20 years of experience, what would you say to a budding IT professional?
Explore your interests. So, our field touches almost every other field. And so I don't think there's any reason why you should not apply your talents to healthcare, entertainment, engineering, real estate, doesn't matter. That would be my advice. Find what you like and how you could contribute there.
All right, so a bit of a personal question for you, Brian. I'm just smoothing it over. Have you ever worked in any other industry besides healthcare?
One more time?
Have you worked in any other industry besides healthcare?
Yes. Finance, education, entertainment a little bit. I can't think of too much more, but...
All right, so what was your draw then to information technology? As you rightly said, it touches on many different fields. Perhaps you're even continuing to work in the other fields.
Yeah, it was just fascinating to me. I got into computers fairly late in life, like, past 17 or something like that. And I don't know, it was just very entertaining. I started off playing a lot of games, as a lot of kids do. And then it just kind of grew from there. So when you see your kids playing games, don't be too harsh.
Nice.
You never know where that might go. Gaming is not a great platform that you could apply your skills to.
So, Mr. Fough, what does it take to be an IT professional?
Well, IT is very broad, but for what I do, which is building systems, it takes a little bit of curiosity. You have to ask the right questions. You have to be curious. You have to learn. You have to listen a lot. Very important. The things that, like they say, it's very much what's not said in addition to what is said. So, and then you need an analytical mind to make sense of chaos. And then patience, because things take, you have to exercise some sort of patience. Be confident that it's going to happen.
Nice.
All right, and the final question that I have for you, Brian, is this. Based on what you've told us about your work in healthcare and IT, the way that they merged and how the end user, basically the patients, can benefit from the work that you do, do you think that there are possibilities, perhaps prospects, for the work that you do and other professionals like you benefiting people here back home in the Federation, improving our own healthcare system in those ways?
Most definitely. And if it comes to that, I hope somehow I'm a part of that. But, just imagine, we're talking online right now, right? Mm-hmm. So we're, thousands of miles away?
Yep.
You could be Bastia to Sandy Point, but Bastia to Washington, D.C. or New York City. As long as the internet connections are fairly stable and you could sustain it, then you could seek healthcare from any professional. Of course, there's always legal complications and these other things, but
well, what I think
and that's a whole other thing. But there's a lot of scope for it. We have a lot of smart people back home.
Indeed.
And I'm sure we can make it happen.